Okay, my key takeaway was that we all have permission. Like she gave so much permission, right? Very relatable. Thank you so much. So now we have Dr. Esther Melamed from Austin, and this is another hot topic. I know that you all are excited for this, the gut-brain immune connection and the influence of the microbiome health on autoimmune conditions and fueling wellness. Welcome.
Thanks so much for having me, and thank you to the organizers for the opportunity to speak today. It's really wonderful to see all of you here. There's so much energy in the room, and we've learned already so many important and interesting things, not only about the pathophysiology of NMO, but how to conserve energy and how to manage fatigue and how to be happy. Thank you to our earlier panels for sharing all of those important thoughts. So as I said, I'm really super excited to talk to you about one of my favorite topics, which is the gut microbiome. And the gut microbiome is really important, as I hope I'll share with you, is because Hippocrates had said that you are what you eat. And so it is so important to think about what we eat and how it's going to influence our brain. So how does that work? Well, it turns out that microorganisms are all across our body. And these microorganisms populate our skin and our respiratory system, our lungs, and our oral cavity, and our gut, and our urogenital system. And these microorganisms, it's crazy to think, but they actually outnumber us in many different ways. So whereas we as humans have 10 trillion cells, the microbes have 100 trillion cells across the gut microbiome. And we as humans have a petty 20,000 genes in us, while these microorganisms have 2 to 20 million genes. And it is said that 80% of the immune system is actually in the gut, which is crazy to think about because it starts to really influence our understanding that what we eat actually influences our immune system by modulating these gut microorganisms. So what is the gut microbiome? It's a collection of trillions of these microorganisms, and they're made up of bacteria and viruses and fungi and protozoa, but mainly it's bacteria. And so a lot of the studies that have been done primarily look at bacteria because they just outnumber the other types of microorganisms. And what do the gut microbiota do for us? Well, they do a lot of different things. They help us with digesting our food. They help to train our immune system. I mentioned that 80% of the immune system is actually in the gut. They help to protect us against bad pathogens. And they help us to make and modify different types of vitamins, like different types of B vitamins and vitamin K. And they help our food to go down the GI tract in a way that it should be, where it gets digested and we get different micronutrients from the food, and then we absorb the food. So as you can see, there are far-reaching effects of these microorganisms on our health and in being able to keep us healthy. What happens to microbiome over the lifetime? Well, the microbiome actually changes. So as we go from being a baby to being a child and to being an adult, we initially have an increase in microbiota in our early life. And then the microbiota start to actually decrease with older age. And there is an increase in different types of opportunistic pathogens as we get older. And so we have to sort of keep that in mind, because the same foods that we eat as kids may actually not be as good for us and may cause more problems as we get older. So kids, one represented here in the audience, can eat anything and be fine, but it's not always the case for us adults. We actually have to think about what we eat in order to keep our metabolism and in order to keep our fatigue at a reasonable level and to be able to keep our sleep at a reasonable level. And this is all thanks to the gut microbiota that we really have to protect and take care of, just as they do that function for us. So factors that I like to think of in a mnemonic that influence our gut microbiome include dapper guts. These factors include our diet, include antibiotics, physical activity, the pH level, different types of toxins in the environment, our sleep, what kind of genetics we have, whether we're using probiotics or prebiotics, how long does food take to get through our gut, the transit time, and whether we're male or female. And all of these factors are going to influence what happens to the gut microbiota and how the microbiota then have downstream actions on our immune system. So what happens when the gut microbiota are not behaving properly? Well, what happens is that there is a lot of dysfunction that ensues. So there can be intestinal barrier dysfunction, meaning that the gut barrier that is between the gut and the blood actually becomes leaky. And there are substances that really shouldn't get into the blood, but actually start to get into the blood because of this leaky barrier. There can be immune dysfunction that ensues, and that's because 80% of the immune system is said to be in the gut, and so what happens in the gut actually doesn't stay in the gut, but it does really influence, the gut microbiota influence the immune system, and then the immune system can actually leave the gut, and if it's inflammatory immune system, then it will be able to get to different organs, including the brain, and affect the brain in a negative way. There is abnormal secretion that happens. We may not be able to digest our food as well. We may not be able to absorb nutrients from our food as well. And there may be hypersensitivity to foods that we develop as a result of these gut microbiota not working well. And the GI motility may be affected. So people will develop constipation or diarrhea because the gut microbiota are changing. And very, very importantly, the gut-brain axis gets perturbed. So what is the gut-brain axis? So this is basically a highway between the gut and the brain. And the highway is in two ways. So we had talked earlier about the challenges of getting to the hotel and navigating around Dallas in certain parts. Well, this is similar to what happens in this gut-brain axis, this highway. If the gut microbiota are not doing well, are not happy, are not performing well, that affects this highway between the brain and the gut. And a lot of inflammatory substances can go to the brain. And when the brain is not happy because it's inflamed, it can send messages via the vagus nerve to the gut and also influence its function. So the gut-brain axis is one of the, I would argue, one of the most important parts, highways in our body. So what do we know about gut microbiota in NMOSD and MOGAD? So what we know is that there are different types of microbiota that develop in autoimmune diseases. So in this picture over here, you see blue dots and red dots. So blue dots are the microbiota from patients who have NMO, and the red dots are healthy controls. And you can see that they live in different worlds. And that's because this kind of a statistical technique allows us to see that the microbiota are actually different when we look at patients who have autoimmune disease, like an MOSD, and I will include MOGAD also in that definition, and people who have a healthy microbiome. So the gut microbiota are different. And how are they different? Well, there are increased types of inflammatory microbiota, and that is called gut dysbiosis. And the types of bacteria are like Streptococcus and Clostridium perfringens. And then there are decreased good bacteria. And these are bacteria that make metabolites like butyrate and acetate and prevotella. So when you think about a healthy gut of an infant, and then we look at autoimmune diseases, gut microbiome, it is completely different. And all those beneficial bacteria that infants have are now depleted in an autoimmune disease state. So how then does the gut dysbiosis, or these abnormal bacteria in the gut, how do they influence the brain via this highway that we talked about? Well, there are lower short-chain fatty acids, these metabolites, primarily butyrate and acetate. There is an increase in autoreactive T cells, which we've been learning about today. So these are the T cells that go and attack. And they're called Th17 cells. They make their chemical messengers that are called cytokines, like IL-17, IL-22, IL-6. And so all of these inflammatory markers are increased as a result of gut dysbiosis. And because there's so much inflammation that is making its way up the highway to the brain, the barrier between the blood and the brain, called the blood-brain barrier, becomes leaky itself. And so now all of these immune cells like T cells and B cells that are making aquaporin antibodies and MOG antibodies can come into the brain and lead to an attack. So this is how we think the connection between the gut and the brain works. All right, but let's take a step back and think about aquaporin and gut bacteria, and how do these gut bacteria and aquaporin, how are they connected? Well, the way that they're connected is through mimicry. So if we think about mimicry in nature, if you look at this beautiful picture of the Asian moth Maya, you can see that there are these two flies that it looks like the coloration of it is that there are these two flies and they're munching on feces. And that's the coloration of this butterfly. And why does this butterfly have this coloration? And it actually kind of smells bad. That's because it wants to prevent predators from eating it. Makes sense. Now, if we look at this Asian orchid, Papavedium callosum, its mimicry is to look like other flowers and to smell like other flowers. And by doing so, it attracts pollinators. So in nature, there's different ways to prevent predators and to attract beneficial beings to come. And how does that connect to NMO? Well, we know that there's molecular mimicry, so that was mimicry in nature. But in NMO, we know that there is molecular mimicry. Dr. Scott Zienville and colleagues have very elegantly described that one of the bad bacteria in the gut that we talked about, Clostridium perfringens, actually, when you look at it at a molecular level, it looks like aquaporin. So a part of aquaporin looks like a part of Clostridium perfringens. And why does that matter? Well, it matters because Clostridium perfringens may be hiding from the immune system because it looks like aquaporin, right? Because that's a human protein. But then what happens when the immune system catches on? Well, when the immune system catches on that there's something that is actually foreign that looks like a human protein, not only does it start to attack this foreign bacteria, which is actually in the gut, but it can also start to attack aquaporin. So thereby we develop these aquaporin antibodies, MOG antibodies, that can then go and attack parts of the brain that leads to an NMO attack. And then T cells join in and cause a lot of inflammation. So now you might be asking yourself, well, I mentioned that there are medications that can affect the gut. So what about NMO medications? Can they modify the gut microbiome? And I'll tell you that this area is very much in its infancy. We're still learning about how medications, NMO medications, may affect the gut microbiome. But there's a little bit of data that has demonstrated that even short-term use of rituximab for about 3 months can actually change the intestinal microbiota and make the gut microbiota look less inflammatory. And with a medication like mycophenolate, there's also evidence that the microbiome is changing, and there may be less GI toxicity as the microbiome changes with mycophenolate use. So there's still a lot that we need to learn about how the gut microbiome is affected by these medications, but it looks very promising. All right, so we'll switch gears and talk a little bit about what can we do for our gut microbiome to make it more healthy. And again, this is an area that we're still learning about, and there's a lot that we still don't understand. But as you have already seen, there's lots of prebiotics and probiotics and symbiotics on the shelf. Anyone can really put a medication like this in the pharmacy. They're not FDA approved. And we don't completely understand what they do, but the idea behind them is really good. So prebiotics are these non-digestible food components that help the beneficial bacteria in the gut. So things like garlic and asparagus and oats and bananas can help the beneficial bacteria. It's basically food for the good bacteria in the gut. The probiotics are live cultures of bacteria. And so those you can either get from foods like yogurt and kefir and kimchi and sauerkraut, so fermented foods, or you can get a supplement. And symbiotics sort of combine a prebiotic and a probiotic. So you take a probiotic and it comes together with food for those live bacteria. And fiber and inulin can be included in these symbiotics to help the probiotic do a better job. So you might ask, do I need to take a probiotic or a symbiotic or a prebiotic? And the answer is, you can get all of this from your food. And at this point, as we're learning about these different strategies, it's probably safer to get all of them from food, although studies are underway to determine which specific probiotics and at which points of our lives, for males versus females, may be beneficial. So how do you eat for your microbiome? So my suggestion would be to eat a diverse and colorful diet, which is going to include your vegetables, your fermented foods, like yogurts and kefirs and kimchi and miso, different kinds of legumes, like chickpeas and black beans that were very delicious for lunch today. So you got started on your microbiome treatment already. Omega-3 rich foods like salmon and sardines and walnuts, and polyphenol rich foods like berries and green tea and dark chocolate. So now you have a reason to eat chocolate. And foods that you want to limit or avoid are the foods basically that come in a bag. So anything in the store that comes in a bag is bad for you. I'm very sorry to tell you, but that's the case. Ultra-processed foods, refined sugars, artificial sweeteners, too much red meat is not a good idea. Saturated foods, low-fiber Western diet. Alcohol can disrupt the gut lining and flora, but may also have some beneficial effects as well. So alcohol may not be altogether terrible. And other things that you need to keep track of, as we learned earlier, sleep is super important. And disrupted sleep can lead to disrupted gut microbiome. So make sure to listen to all the techniques that you learned about today to make sure that you're sleeping well. Exercise, so not just important for fatigue, but also very important for your gut microbiome. Even 30 minutes of walking can show measurable effects, beneficial effects on the microbiome. Stress management. So stress is not good for us in many different ways, but it also changes our gut. So meditation and listening to music and spending time with your favorite people in your support groups and at home and at work and at the infusion centers is what matters. And medication. So if you have to take an antibiotic, be nice to your gut microbiome. Make sure you're eating as healthy as you can, and if needed, then take one of those probiotics for a short term. And then immunosuppressant medications, our immunomodulatory treatments for NMO, may be affecting the gut as well, as we will continue to learn about this area. So, key takeaways. Gut microbiome is a very, very promising field. There's a lot that we still need to learn. We need larger studies. Diet really matters. So what you eat is, in many ways, who not only you are, but who your gut microbiota are. And there is no yet proven microbiome-based therapy in NMO, but research is ongoing. So with that, thank you very much for all of your attention. I'm happy to answer any questions later on. These are the amazing students that I have the honor and pleasure of working with in my lab at UT Austin. Thanks so much for your attention.